Along with the rise in summer heat comes a rise in COVID cases. Triad doctors tell us they are seeing an uptick in respiratory cases.
But they're also telling us not to panic. WFMY News 2's Giselle Thomas spoke to doctors to learn more.
Have you noticed your friends, coworkers, or even classmates getting sick? Well, COVID might be the cause. A Triad doctor says they are currently seeing a slight uptick in cases, with numbers similar to what they saw in January and February of last year. But don't be alarmed, this is not a repeat of 2020.
Summertime usually means more time outside, whether that's hanging out with friends or traveling. As the respiratory illness season kicks in, a local infectious disease expert says numbers are up, but not in a way you may think.
Some of the notable differences about our summer wave of COVID this year compared to other years is even though we're seeing a lot of cases and our wastewater numbers reflect that, we're not seeing a lot of hospitalizations. In fact, most of the people who have COVID in the hospital are actually in the hospital for some other reasons and just happen to test positive for COVID because they have a stuffy nose.
Dr. Uhl says the COVID variant flirt is easier to catch, but it does not pack a punch like other variants. He says most of us have antibodies from previous exposure to the virus.
Even though more infectious and more likely to grab a hold of your nose or your back of your throat, they're less likely to cause severe disease.
He says COVID usually levels out around this time of the year, but expects it to peak soon.
My prediction, Dr. Uhl's prediction, is within the next couple weeks, and that's based on our prior history with summer waves of COVID.
The Guilford County Department of Health says COVID is a year-round concern. It's important to note that respiratory illness season includes flu and RSV. The health department says both flu and RSV peak between October and February.